Hello, welcome to the short overview of the forearm nerve blocks. Forearm nerve blocks can be used to provide analgesia for several injuries of the hand. As a brief anatomy review, recall that the sensation to the hand is provided by three nerves, the ulnar, median, and radial nerves. The ulnar nerve provides sensation to the hand in the region highlighted in purple, the median nerve provides sensation in the region outlined in green, and the radial nerve provides sensation in the area outlined in orange. Common indications for forearm nerve blocks include lacerations, fractures, dislocations, and abscesses of the hand. In order to perform the block, you'll need to gather your supplies. Order the anesthetic that you'll require, which is lidocaine. You'll also need to find a 10 cc syringe, 20 to 23 gauge needle, an 18 gauge needle, ChloraPrep, Tegaderm or a sterile probe cover, ultrasound gel, and of course the ultrasound machine. When performing the block, position yourself, the patient, and the machine as demonstrated here. The patient's arm should be on a flat surface with the palm facing up. The ultrasound machine should be placed in the direct line of sight of the provider performing the block.
First, we will review the ulnar nerve block. The ulnar nerve block can be used to provide analgesia for injuries such as medial palm laceration or burns, medial dorsal hand laceration or burns, fourth metacarpal fracture and fifth metacarpal fracture, aka Boxer's fractures, and injury to the tip of fourth and fifth digits. To perform the block, place patient's arm onto a flat surface with the palm up as above. The patient may need to hypersupinate their arm. Positioning for the ulnar nerve block can be tricky due to the location of the nerve. It is important to ensure patient and provider comfort when performing this block. Use the linear transducer with a probe marker facing you. Scan in the transverse plane in the distal half of the volar forearm along the ulna. The forearm nerves are relatively superficial. Locate the ulnar nerve as the hyperechoic structure running adjacent and medial to the ulnar artery, deep to the flexor carpi ulnaris. Move transducer proximally to visualize the increased separation of the ulnar nerve and the ulnar artery. This clip demonstrates the ulnar nerve block. After cleaning the injection site and drawing up the anesthetic, use an in-plane approach to insert the needle from the anatomical medial aspect of the forearm as demonstrated above. Trace your needle tip adjacent to the ulnar nerve. Aspirate to ensure that you are not in a blood vessel. Inject the 5 cc of anesthetic to bathe the nerve. Watch for hydrodissection. Only 2 to 5 cc of anesthetic is needed.
The median nerve block can be used for lateral palm lacerations or burns, first through fourth metacarpal fractures, and injuries to the tip of digits 1 through 4. To perform this block, place the patient's arm onto a flat surface and supinate it as above. Use the linear transducer to scan in the transverse plane, starting midline at the wrist and moving proximally about halfway up the forearm. Locate the median nerve. It is a hyperechoic structure sitting on the fascial plane, medial to the radial artery at the intersection of the flexor digitorum superficialis muscle and the flexor digitorum profundus muscle. Move the transducer proximally to visualize the increased separation of the median nerve and the radial artery. Approach with a needle from the anatomic medial aspect of the forearm toward the radial artery, and inject the local anesthetic to bathe the nerve.
To review, the radial nerve block can be used for injuries to the lateral palm or lateral dorsal hand, fractures to the first through fourth metacarpals, or injuries to the tip of the thumb. To perform this block, you'll want to place the patient's arm on a flat surface with the hand supinated. The radial nerve is the hyperechoic structure running adjacent and lateral to the radial artery, deep to the brachioradialis muscle. Here it's highlighted in orange. Move the transducer proximally about half a centimeter up from the volar forearm to visualize the increased separation of the radial nerve and the radial artery. The nerve will be approached by the needle from the lateral aspect of the arm, as demonstrated in this image. Just as for the ulnar nerve, the goal is to inject a small amount of volume of local anesthetic adjacent to the nerve to bathe it. Forearm nerve blocks are not without complications or risks. Complications of the nerve block include pain, bleeding, infection, intramuscular hematoma, nerve injury, and most feared is local anesthetic systemic toxicity. Use appropriate dosing of the anesthetic, aspirate for injecting to avoid intravascular injection of local anesthetic, and be sure to monitor the patients for symptoms of local anesthetic systemic toxicity such as perioral numbness, tingling, and cardiovascular dysrhythmias. Know where to find intralipid in case of an emergency. Contraindications to these nerve blocks include cellulitis overlying the injection site, abscess over the injection site, an allergy to the local anesthetic, or concern for an acute compartment syndrome. In this video, we have reviewed how to perform ulnar, median, and radial nerve blocks. We hope that you found this video helpful, and please reach out to us if you have any questions.